So I exactly did what you all thought. So I just restarted her on ticagrelor, anticoagulation with low molecular weight heparin, and repeated the coronary angiogram for 10 days. And as you can see in this angiogram still picture, the thrombus cleared, and even in the IVS showed the same. The thrombus actually disappeared. And then what I did was, so what are the next steps? Whether to send him for bypass or whether to restent, or whether to start him on anticoagulation. So what I did try to post-dilate as much as possible. But what do we do for the right coronary? Should we check the right coronary and the circumflex, which were normal? Again, that was another question in my mind. So what I decided to do is, even though angiographically the RCA stent was patent, I thought we should image this also, because the circumflex stent, as Dr. Julio pointed out, was also very hazy and looking a little bit a little enlarged. So I did do an OCT to the right coronary artery, and this was the image, and you could see that there is again the RCA stent has you can uncovered struts as well as some kind of positive remodeling, which I will show you in this picture, which was not seen in the right coronary angiogram. So some of the areas are well covered struts, but then there are areas where it's uncovered. Here you could see that there are areas of positive remodeling of the vessel and uncovered struts at the end. So how do you manage? We have all the stents are now patent, but not aneurysmal, but actually they're flowing well, no thrombus. At this moment, there is no role for bypass surgery, nor I could post-dilate and oppose the struts completely because it's too much dilated. So I decided to keep this patient on medical management, but continue ticagrelor and aspirin and have a very close follow-up. That is a plan. But then I would request Dr. Selvamani now to talk on the next steps, as well as the role of OCT. Since I did an OCT to the right, which was the positive remodeling was identified, I would request Selvamani to talk on OCT in the role of stent thrombosis and failure.